Today's topic is heart failure and the drugs for the treatment of the heart failure. And the heart failure is a condition when it cannot pump sufficient blood, and the patient will develop fatigue, edema, and uh, the treatment is uh, directed towards stimulation the uh, force of the heart muscle contraction, and also to decrease the rate of the contraction, the rate of the heart beat. So the heart muscle is different from the other skeletal muscles because it has uh, different action potential with a plateau because of the calcium uh, influx. So and there are four phases for the uh, cardiac muscle action potential, and also they have a long phase of the refractory period. So actually absolutely and absolute period of refractory, and the uh, non-absolute. So partial refractory period. So and also the heart muscle has an automaticity, automaticity, so it can contract itself, but normally the heart muscle is driven by the pacemaker, that is sinoatrial and atrioventricular uh, nodes. So sinoatrial is the main pacemaker, and the normal heart contraction is usually uh, from 80 to from 60 to 80 beats per minute, and it usually driven by the sinoatrial node. Um, the first drugs that were effective for the treatment of heart failure were cardiac glycosides, digoxin and digitoxin. So these two drugs are obtained from the digitalis, that is a herbal plant, and uh, these nowadays they are used less frequently because of the side effects, because the cardiac glycosides are very toxic and also lead to the GI side effects, the color vision uh, diseases, and other adverse effects that uh, can increase with the accumulation of the drug, and also the frequent administration is required, and the long duration drugs like digitoxin is dangerous because there are uh, antidote, no antidote, and the drug binds to the albumins in the blood, so there is no way to treat the toxicity. Even the fresh blood transfusion is not effective, and that is why most of the patients with the digitalis toxicity can be can be treated only with the uh, supportive treatment like antiarrhythmics for the arrhythmia, and also the there are some antibodies for the digitalis, but they are very expensive and not readily available in every hospital. So that is why nowadays the most commonly used drug for the uh, heart failure is angiotensin converting enzyme inhibitors, or ACE inhibitors, including captopril, enalapril, lisinopril, fosinopril, and other uh, ACE inhibitors. So the mechanism of action is based on the decrease to the preload and decrease of the afterload to the heart. So the load uh, is decreased, and that is why uh, the heart can still pump well. So this eventually decreases the resistance of the vessels also, and that compensates for the heart failure. And also other inotropic drugs like beta adrenergic mimetics are used, like dobutamine. Dobutamine is injectable and only used in hospitals for the acute heart failure. And dobutamine directly stimulates beta-1 receptors of the heart and increases the heart contraction and heart rate, and that helps to overcome the acute phase. But heart failure is congestive heart failure, or CHF, is a chronic disease, so the patient requires continuous treatment throughout life, and the usual treatment are the angiotensin converting enzymes, so the most effective one. Recently, the beta blockers also were introduced for the treatment of congestive heart failure. However, they decrease the heart uh, rate, and they decrease the contraction force of the contraction. That is not very logic, because we have to increase it, vice versa. But recent studies of metoprolol for the uh, arterial hypertension in patients with congestive heart failure suggested that the mortality rate reduces, 5-year mortality rate reduces in the patients with heart failure that are taking metoprolol. So that is why the mechanism is not yet understood. Still the effect is there. That is why beta blockers are now indicated for the CHF. So despite they are opposite to the beta mimetics like dobutamine, but metoprolol, atenolol is less effective, and other non-selective beta blockers also not recommended. Metoprolol is recommended one. Then uh, the cardiac glycosides still are used and very effective. There are two drugs, digoxin and D-digoxin. Digoxin is short-acting, D-digoxin is long-acting, and they are administered orally. And the drug requires a dose titration and started with the low doses. So starting dose is 0.5025 gram. So this is very low dose, so it's like uh, very potent drug. And the cardioglycosides have uh, many actions on the heart, and they increase the refractory period, that makes they decrease the heart rate and the duration of the diastole, and that makes the heart rate to rest more and then contract, and they increase also the contraction force. So all these effects are all beneficial for the congestive heart failure, and that is why uh, digoxin and digitoxin are very highly effective, and despite their uh, low safety and high toxicity, they are still indicated and used for the treatment. And pairing with the angiotensin-conjunctive enzyme inhibitors, they are like same effectiveness is the same, but angiotensin converting enzyme inhibitors are safer, and the dosing is easier, and but the adverse effects are also very prominent for the ACE inhibitors. So most patients complain for the dry cough, and also orthostatic hypotension is very common. So that is why ACE converting enzyme inhibitors are still prescribed, but should be considered. They should be considered at the first line. So like first line treatment is ACE converting enzyme inhibitors, but they still are they have more adverse effects than any other group, and also are dangerous for when starting treatment and when stopping treatment. So treatment should be started and stopped continuously, not abruptly. So same is with the beta blockers. Beta blockers should be stopped uh, continuously. Okay, then there are many other drugs that include hydrolazine and other inotropic drugs, but these are used seldom and have low survival rates. So that is why the treatment goal is to increase the survival, like 5 year or 1 year survival rate. So and these three groups are most commonly used. So and I think that is all for today, and if you don't have any questions, then see you next week.